The More Than Ready research I led in 2012 in partnership with VicHealth and the Social Research Centre involved a survey of 600 Victorians about their willingness to speak up against certain situations of sexism, harassment and discrimination against women. We looked at whether people were more or less likely to step in at work, on the job or at their local sports club. Our research found that 1 in 3 Victorians have witnessed sexism and discrimination against women during the past year, and almost half said or did something to stop it. A further 1 in 10 also said that they'd wanted to intervene, but didn't say or do anything to show that they disagree with sexism or discrimination against women at the time. Yet over 90% of Victorians view persistent unwanted sexual advances and verbal abuse towards women as never or rarely acceptable. And over 80% view sexually harassing comments as never or rarely acceptable. Together, this shows us that there is strong support in the Victorian community for individuals to take bystander action to intervene when witnessing sexism and discriminatory attitudes and behaviours towards women in our community. And there's even stronger agreement in the community that harassing or abusive behaviours are not acceptable. However, people were more hesitant to act and to respond to more subtle behaviour, such as sexist comments, jokes and slang. So someone telling a sexist joke about women in a social setting, for example, was less likely to prompt bystander action. 1 in 5 of our survey respondents said they would accept sexist slang, and 2 in 5 would accept jokes in social settings. While 44% say they'd take action when witnessing a sexist joke, more than a quarter say that they'd feel uncomfortable but wouldn't say or do anything to intervene. This is an important finding because what it says is that while there is a sizable minority who accept sexist attitudes, whether they're expressed in language or through sexist jokes, the majority of Victorians say they'd either take action or they'd feel uncomfortable in response to sexist attitudes. We know that sexist, derogatory and discriminatory behaviour is upsetting for the person who experiences it. But what our research also demonstrates is that these behaviours impact the people who witness them, particularly when they feel powerless to act.
Authorised by VicHealth, 15 to 31 Pelham Street, Carlton, Victoria.